You are a frequenter of our HITLAB events, but for those that maybe don't know you, please just take a moment to give a little bit about your background.
Yeah, sure. Thanks, Riley. And it's great to be here again this afternoon. I'm David Berger. I'm the CEO of University Hospital at Downstate. I am a surgeon by training and actually went to medical school at Downstate, did my general surgery training at Downstate, and then did surgical oncology at UT MD Anderson in Houston. I have about a 25-year career in hospital administration and a master's in healthcare management from Harvard T.H. Chan School of Public Health. I've been at Downstate now for 4 years after a 20-year stint at Baylor College of Medicine in Houston. I am very, very much an advocate of digital health and AI and how it's going to transform healthcare, and I'm a board member of the Breakthrough Alliance, part of HITLAB.
Amazing. Thank you for that excellent transition. So as Stan mentioned, let's talk a little bit about how we can realize the potential of AI in healthcare. So what are some of those implementation challenges that you're facing regarding AI?
So I think one of the biggest challenges is educating the workforce. I think there is a huge amount of misunderstanding of what AI is. There's a huge amount of fear of AI, especially AI taking over people's work and forcing them out of the workforce and people losing jobs because of artificial intelligence and digital health tools. So I think really the first thing that we're embarking on is trying to educate the entire workforce within the healthcare ecosystem that we are part of as to what AI does, how can AI help them become more efficient in what they do every day, and the fact that AI is not the boogeyman, but actually is potentially an extremely useful tool.
Yeah, I think AI needs to get a better PR team so that they can combat some of the false narratives that are being spread out there that are creating some challenges for you. Can you talk a little bit about some of the use cases that you're considering implementing?
Yeah, so when I look at digital health solutions and AI specifically, I look at 4 specific areas within the healthcare ecosystem, especially around hospitals. So the first, and we just heard about supply chain, but back office functions, revenue cycle, supply chain, coding and billing, those kind of issues is one. The second place I look at it is in terms of the front end, which is access, actually helping people get access to the healthcare system and getting the proper access to the healthcare system. And then inside is clinical care delivery. So there's the operational issues associated with clinical care delivery. How do we schedule x-rays? Who do we prioritize? How do we get patients through the hospital? And then there's actually the delivery of clinical care. So what does that mean? That means decision support. It means using radiology and AI to supplement how radiologists are reading x-rays, mammograms, head CT scans. So those are really the 4 different areas. Now, in terms of implementing and how you prioritize and thinking about the workforce and some of the challenges with the workforce, I really look at the back end first in terms of use cases. I think those are some of the most well-developed use cases in AI, especially looking at revenue cycle, coding and billing issues, pre-authorization, dealing with denials. I think that is a no-brainer in terms of being able to use AI, and that comes with some of the least amount of worker challenges, although you are potentially displacing some of the people that are involved in those specific functions. Much harder and much more challenging is dealing with the clinical issues. And I'll give you an example of an issue I ran into. So one of the biggest places for medical error is the issue in incorrect diagnoses. So we've been working with a company, and they help provide decision support at the point of care within the electronic health record for clinicians. And we had a pilot, very reasonable cost sharing, not a big expense to the institution, so very excited about it. Well, we gave it to our internal medicine residents and no one used it. And we went to the chief residents from internal medicine and we said, what's going on? This is really simple. It helps make diagnoses. It helps determine the care pathways. Why isn't it being used? And the medical chief resident said, well, the junior residents really need to learn how to do this stuff on their own. There was a total failure in understanding what the problems with relying on junior residents is or are, and how this technology and artificial intelligence can actually help them to do their jobs much better.
Yeah, you certainly don't want to take away the learning opportunities for those providers, but you want to help them learn about the future for them, which is that AI is going to be involved in their career path. And so learning how to adopt it is going to be an important part of their journey. Can you talk a little bit more about where you see that future of AI in healthcare and where it's going and kind of what your vision is?
Yeah, so I think, and you've heard from other speakers about AI this morning, this afternoon, it's clearly going to transform healthcare. And the big piece of it is the issue of how much data we now have and how much data is added to medical knowledge every single day. And how do we apply that data most effectively to take care of an individual patient, where they want to be taken care of, and to prevent them from developing significant comorbid and potentially mortal disease. So that's really where I think AI is going to have the most impact, and that is prevention, early identification of medical issues to head off deterioration and significant complications from medical problems, and within healthcare settings, being able to identify people at risk from progressing and developing bad outcomes and being able to intervene much earlier. I think that we need to start looking at how we educate medical providers. We currently spend a huge amount of time teaching physicians, nurses, technicians, things that they have to memorize that they can access within seconds anywhere. So, for example, I spent a huge amount of time, and this still happens. Medical students are forced to learn what's called the Krebs cycle, which is glucose cycle, how energy is produced in the cell. What an amazing waste of time. I can pull that up in seconds. Medical education must now include informatics and specifically how to use data and how to use digital and artificial intelligence. We need to have a healthcare workforce that is digital native, just like we now have generations that are internet and digital native. We need a healthcare workforce that is totally digital native.
Yeah, I totally agree with you. And I know that there's a lot of uncertainty around AI in the future and in healthcare, but with people such as yourself leading these charges and initiatives, I certainly feel better. So hopefully we can, learn from you and follow your guidance and, make sure that we're implementing things in the proper way. So thank you again for your time. It's always great to chat with you. And that's all we have for today from Dr. Berger, but please feel free to connect with him on LinkedIn, and we really appreciate your insights.
Yeah, thanks again, Riley. It's always great to be part of HITLAB and the Symposium, so thank you.